Aloha! Welcome to Rehabilitation Hospital of the Pacific. We are the only accredited inpatient rehabilitation facility in Hawaii. Established in 1953, we offer comprehensive physical, occupational, and speech therapy in our inpatient hospital, as well as at our 3 outpatient clinics located on Oahu and the Big Island. Our core programs serve patients with stroke, traumatic brain injury, spinal cord injury, fractures, amputations, work-related injuries, and other medical conditions.
Rehab is a very special place. In part because of our focus on rehabilitation services, we've been able to develop the largest pool of skilled rehabilitation professionals in the state, including physical therapists, occupational therapists, speech therapists, rehab nurses, along with, of course, our rehabilitation physicians.
When patients come to rehab, they can expect to participate in 3 hours of therapy 5 days out of the week. While they're here, the patients will receive physical and occupational therapy services and sometimes speech and recreational therapy.
Every patient that comes to rehab poses a unique challenge, and what we do is we tailor the exercises and the intensity of the exercises to achieve the best outcome.
3 hours seems like a lot, but we break it up. So if I have a patient who cooks, who's a chef, we might do 4 cooking activities a week. If they need to go back to work, well, I need to prepare them.
One of the other important features is the communication between the physiatrist and the rest of the rehabilitation team. We have formal meetings once a week to discuss each patient and how they're doing in therapies.
We have quite a number of advanced technologies that are used to optimize the care that we provide to our patients. The Dynavision is a visual field evaluator. So for patients who've had some type of a neurologic injury that has caused impairment of their vision, it allows us to map out their visual field.
We also have a driver's evaluation program which tests patients' visual reflexes, depth perception, and ability to problem solve with the use of our virtual reality driving simulator.
One of the cool things that I've had a chance to work with is the AlterG zero gravity treadmill. And what that does is it eliminates up to 80% of their weight. It can unweigh you to the point where you don't feel the pain. You can do a lot of things that you normally wouldn't be able to do with full gravity.
We recently also got the DAISY system, and that allows us to see the swallow as a waveform. It tends to help them to know what it is they need to do to improve their swallow.
The bionic leg is a useful tool that we use to supplement the weakness in someone's leg, but it assists essentially in straightening your knee so your knee doesn't buckle and you don't fall.
Here at our Nuuanu outpatient clinic, we have what is probably the finest therapy pool in the state. We have a retractable roof over the pool, which allows for the natural environment to come in and makes it much more comfortable. They can exercise in the pool, which helps to relieve some of the stresses of gravity from their joints and allows them to more fully participate in exercise.
The ART program helps patients redevelop their fine motor skills by using their hands to hold a paintbrush. It will help to improve their vision by having them scan, see depth and color, and this translates into real life when people have to fasten their clothing, feed themselves, and brush their teeth.
After I had my stroke, of course, I was very limited because I was very used to doing things, multitasking and all of that. And then for once in my life, I was a patient. I think I have this stubborn streak of independence in me that I didn't really want to depend on anyone to do things for me. But when you're a patient, you have to listen to your doctor, you have to listen to your nurse, and do the kinds of things that they recommend for you because this is where you can get the maximum training that you need so that your life will go back to normal.
I feel that coming to rehab is important because we have an experienced staff, we have wonderful technology, and we have a team that truly cares about the patient. And you're going to receive the intensive therapy that you need to be able to return home or back into the community.
When I see patients coming here, I put myself in their shoes and I ask them what their goals are, and that becomes my goal as well, working with them, is wherever they want to get to, I try to help them get there.
And one of the things I noticed from the very beginning is it's a group of people that advocate for their patients more than any other place I've ever been. Patients aren't just a number here, they're people. And the staff really comes together to work as a team in order to meet the patient's needs and make sure that we're tying up all the loose ends.
With our wide array of unique programs and services, Coupled with our specialized staff of nurses, therapists, and physicians, we can assure that you will receive the most comprehensive rehabilitation care offered in the Pacific. So when it comes to receiving a customized rehabilitation plan and the best care and services, Rehabilitation Hospital of the Pacific is the right choice.